On June 10th, the most powerful OB-GYN organization in America did something it has never done before. The American College of Obstetricians and Gynecologists looked at the CDC's vaccine guidance for pregnant women and publicly broke ranks. This is ACOG, 60,000 members, the group your doctor's doctor listens to. And for the first time in its history, it published its own maternal vaccine schedule that does not match what the federal government is telling pregnant patients. So what changed? Why now? And what exactly is the CDC saying that made the country's leading pregnancy doctors decide they had to draw a line in public? Let's walk through it. The ACOG schedule, released Wednesday, recommends 4 vaccines during pregnancy: a flu shot, a COVID-19 shot, the Tdap vaccine, which covers tetanus, diphtheria, and pertussis, also known as whooping cough, and an RSV vaccine to protect the developing baby against respiratory syncytial virus. If you're sitting there thinking, okay, that sounds like the standard list I've heard for years, you're right. That is the standard list. That has been the standard list. And that is exactly the point. Because the CDC, under the current administration, has been quietly walking parts of that list back. And ACOG just decided it wasn't going to walk back with them. Here's the part that matters. ACOG is not some fringe coalition. This is the establishment. This is the group that writes the textbooks. When the country's mainstream OB-GYNs feel the need to publish a separate vaccine schedule from the federal agency that has historically set the standard, that is not a small bureaucratic squabble. That is a structural fracture inside American public health, and it lands in the middle of a much bigger war. Health Secretary Robert F. Kennedy Jr. has spent the last year reshaping the federal vaccine apparatus. He dismantled the existing CDC Vaccine Advisory Committee. He replaced its members. He has openly questioned the COVID-19 vaccine recommendation for healthy pregnant women and healthy children. That recommendation, once routine, is now contested at the very top of the agency that issues it. So when ACOG publishes a schedule that still firmly includes the COVID-19 shot for pregnant patients, that is not a neutral medical update. That is a direct response. That is the country's OB-GYN saying, we see what's happening in Washington, and we are not signing on. If this is the kind of story you want unpacked without the spin, subscribe. There's a lot more of this fight coming, and it's only getting louder. Now let's be careful here, because this is exactly the kind of story where everyone wants you to pick a team before you've seen the evidence. So let's slow down. What does the actual data say about these 4 vaccines in pregnancy? The flu shot in pregnancy has decades of safety data. The recommendation to vaccinate pregnant women against influenza goes back to the 1960s in the United States, and it's been studied in millions of pregnancies. The mainstream medical consensus is that flu during pregnancy carries real risk, and the vaccine reduces it. That is the position ACOG is holding. Tdap is the one that protects newborns from whooping cough in their first months of life, before they're old enough to get their own shots. Pertussis can be fatal in infants. The maternal Tdap recommendation exists because the mother's antibodies cross the placenta and protect the baby in that vulnerable window. That again is well established. The RSV vaccine in pregnancy is newer. It was approved in 2023 to protect infants against RSV in their first months. RSV is the single biggest cause of infant hospitalization in the United States. Trial data showed meaningful reduction in severe RSV in babies whose mothers were vaccinated. That's the evidence ACOG is leaning on. And then there's COVID-19. This is the contested one. This is the fault line. Proponents of continued COVID vaccination in pregnancy point to studies showing that pregnant women face higher risk of severe COVID complications, including preterm birth, and that maternal antibodies appear to offer some protection to newborns. Critics, including the current HHS leadership, argue that for healthy pregnant women with prior infection or prior vaccination, the marginal benefit is smaller than it was in 2021, and that the recommendation should be individualized rather than universal. Both of those arguments exist in the literature. The honest answer is that the risk-benefit calculation in 2026 is genuinely different from the calculation in 2021, and reasonable experts disagree about where exactly the line should be drawn. What ACOG is saying is that, in their judgment, the line still includes a recommendation for the shot during pregnancy. What the CDC under the new leadership is saying is not necessarily, and here's where it gets uncomfortable. Because your OB-GYN is now in a position where the professional society they belong to is telling them one thing, and the federal agency that historically backs that society is telling them something else. And you, the patient, are caught in the middle of that. That's the part nobody is really talking about. What happens to insurance coverage when the CDC schedule and the ACOG schedule don't match? In the United States, vaccine coverage under the Affordable Care Act is tied to recommendations from the CDC's Advisory Committee. If the CDC pulls a recommendation, insurers may not be required to cover it without cost sharing, which means a vaccine your OB-GYN recommends could suddenly come with a bill attached. That is not a hypothetical. That is the mechanical consequence of these two schedules diverging. What happens to liability? Vaccines on the CDC childhood and maternal schedules are covered under specific federal injury compensation programs. Vaccines that drop off the schedule may not be covered the same way. That changes the legal landscape for the doctor giving the shot and the manufacturer making it. What happens to public trust? You now have a situation where a pregnant woman walks into an exam room and the message she gets depends on which authority her doctor decides to follow. That is not a stable equilibrium. That is how confidence in the whole system erodes, on both sides. And this is the deeper story underneath the headline. ACOG breaking with the CDC is not just about 4 shots on a list. It is about who gets to define the standard of care in American medicine when the federal agency and the professional societies no longer agree. For most of the last 50 years, those two have moved in lockstep. The CDC's advisory committee would meet, review the evidence, issue recommendations, and the medical societies would echo them, sometimes with minor additions. The system depended on that alignment. Pediatricians, OB-GYNs, family doctors, internists, all working from the same playbook. That playbook is now visibly cracking, and it's not just ACOG. Pediatric groups have raised similar concerns about changes to the childhood schedule. Infectious disease specialists have publicly questioned the new advisory committee's composition. So where does this leave you? If you're pregnant right now, or planning to be, or you love someone who is, it leaves you in a position where you genuinely need to have a longer conversation with your doctor than you used to. Not because the science changed overnight, but because the institutions that translate science into recommendations are pulling in different directions, and the answer to what's recommended now depends on who you ask. This is not the part where I tell you what to do. I'm not your doctor. I don't know your history, your risks, your pregnancy, your immune status, or anything else that actually matters in that decision. What I can tell you is that the disagreement is real. The evidence on each of these 4 vaccines is at different levels of maturity, and the political fight on top of it is making the whole picture harder to read, not easier. What I can also tell you is that when the country's leading OB-GYN organization decides for the first time ever that it has to publish its own schedule because it no longer trusts the federal one to reflect the evidence, that is a moment worth paying attention to, whichever side of this you came in on. Because the quiet part is this: the CDC schedule used to be the floor, the thing everyone agreed on before they started arguing about anything else. If the floor is gone, every conversation above it gets harder, and we are about to find out, in real time, what American medicine looks like without a shared floor. If this is the kind of breakdown you want more of, hit like and subscribe, and I'll keep pulling these threads as they unravel.